Zambia is in the middle of a public health emergency.
Zambia is dealing with one of its worst cholera outbreaks in recent years.
The cholera outbreak in Zambia has claimed over 350 people so far. 30% of the victims are children under the age of 5.
Whether my nephew is dead, I don't know. Whether he's alive is in this, I don't know.
Most of the cases are in the capital city of Lusaka.
It's important that the community response becomes stronger.
And expressed her sympathies with those affected.
For us, we are just waiting that she's going to be discharged. But unfortunately, we are told she passed away.
A cholera outbreak has led to a significant number of fatalities and infections, causing nationwide school closures and a scramble to contain the spread. With over 400 new cases reported every day countrywide in just the last week, and a death toll of over 512 at the time of recording, to argue that the Zambian healthcare system is under immense pressure is almost an understatement. This time around, the cholera outbreak has been so rapid and so widespread that it has reached each and every province of Zambia, with Lusaka experiencing and facing the brunt. Cholera is an infectious disease that is caused by bacteria that is contained in contaminated water. It causes severe dehydration and can be fatal if not properly and promptly treated. The disease is a direct consequence of a lack of adequate sanitation infrastructure and a lack of clean drinking water. The current cholera outbreak in Zambia is severe by historical standards. As it stands, over 13,246 cases that have been reported nationwide, and over 512 people have died. And currently, across the country, there are about 844 people in treatment centers, a majority of whom are children. According to the World Health Organization statistics, if treated, cholera has about a 1% fatality rate globally. In Zambia, that figure is 4 times high. For more context, this is not at all an isolated event in the region. In fact, neighboring countries like Malawi and Mozambique have also reported an increase in fatalities and cases of cholera as well across the region of Southern Africa. About 57% of cholera deaths in Zambia have occurred in communities themselves. The majority of these communities are poverty-stricken, where access to clean water and sanitation infrastructure is often scarce. I strongly believe that a critical understanding of these socio-economic factors that exacerbate an outbreak like cholera are critical to understanding the outbreak itself, but also how to contain it. The story of cholera is not complete without the evaluation of the social, political, and economic factors that are often at play in the spread of cholera. The weather has also been at play here. Heavy rains have continued to hamper the physical access to clean and safe water, intensifying the conditions that allow cholera to thrive. Other experts have also found a correlation and a causal mechanism between climate change, in particular warmer temperatures and more frequent storms, that have contributed to the spread of the waterborne disease. The Zambian government is fighting back. So far, it has launched a vaccination drive which has seen the vaccination of over 1.4 million people against cholera. The Ministry of Health has also turned the Heroes National Football Stadium into a treatment center in order to contain and manage the influx of patients that are coming in. Healthcare workers and volunteers are on the front lines, battling to save lives and educate communities on how to prevent cholera and the importance of clean and safe drinking water. As a global and public health expert, I've learned that we all have a critical role to play in ensuring and keeping our communities safe. It begins by informing ourselves, spreading what we learn, and doing the little we can to support relief efforts. All of this engagement can be so crucial in saving lives and keeping the spread of the disease at bay. Thank you so much for joining me on this episode. My name is MJ, and this was The Take.